Hi, everyone. Thank you so much for joining us today. Excited to have you all here. And we are going to get started. Welcome, everyone, to our session today. We are Pre-Health Shadowing. We are an international student-led nonprofit for medical advancement, and we are really passionate about helping connect pre-health professionals to professionals all around the world. And we're excited to welcome Dr. Ohanaja today, also known as Dr. O, to share with our team. We do have closed captions for this session and all of our sessions to accommodate students of all abilities. If you have any ideas about how to make pre-health shadowing more accessible, please let us know. We are super open to that, and our hope is to make this as accessible for all students as possible. Please feel free to shoot us an email at info@prehealthshadowing.com. Save us as a contact. Make sure to keep us out of your spam so that you're aware of all the sessions that we have. And if you have any thoughts or questions or comments about any of our sessions, we'd be happy to see you over there with any of those. We have a variety of social media platforms to engage with you all on. We have Instagram, TikTok, X, YouTube, Facebook, LinkedIn, the works, and we are excited to connect with you on any and all of those platforms. So please feel free to reach out, give us a follow on Instagram, repost some of our sessions so that your network and ours can come together. Right. We like to get a little bit of engagement for these sessions to start off. So please let us know in the chat where you are from. Massachusetts, LA, Atlanta, Florida. Nice. Perfect. Well, we're happy to see all of you here today. Oop. We realize that there's a variety of time zones all around, so we are excited that you took the time to jump on with us. If you're interested in becoming a part of pre-health shadowing, please register as a volunteer on our website. All of our opportunities are 100% remote, so we really like to get folks from all over. If you are interested, please send us an email, and we'll also hang around after this session if you have any questions for our team. Additionally, if you'd like to join in a bit of a bigger role, you can join our leadership team. You can apply online today. We have a variety of open positions. This too is 100% remote. The only difference is that there would be an increased time commitment. So that's about 5 hours a week. If you think you can manage that, please let us know and we'd be happy to have you join our team. We have a variety of available roles, and we're also super open to new innovative leadership ideas within pre-health shadowing. So if you see any gaps in what we have so far and you want to contribute in a new, interesting way, please let us know. Follow the link on the screen and get in contact with us. Additionally, we do have our high school training program, which we offer all around the nation. So if you are interested as a high school student in bringing pre-health shadowing to your school, you can get involved with us, get connected to us, and bring a sector to your school. So this would be sort of like starting a club, and we would give you hands-on training about how to do that, as well as some tips and tricks. If you can donate, please do. Our program is currently 100% free, and in order to do that, we do need donations. If you can't donate any money, we would love to see you donate your time. So if you wanted to join as a volunteer or as a leadership member, like I mentioned, that'd be great. Another great thing that we ask folks to do is to send this link to their network. We know that some people really want to help out pre-health students and they're not sure how. This is a great way for them to get involved. We hope to make this session very interactive. Dr. O really wants to hear from you on the chat, so please type your questions in there and we can either ask them out loud for you or you can raise your hand and ask your question directly. Please take good notes as we go through this session. We will have a quiz at the end. I'll have a slide at the end of the presentation talking about the quiz logistics and things like that. But it's always helpful to take good notes, especially if Dr. O brings up something that you're kind of interested in or want to do your own research on the side in. It's really helpful to have those names and programs, things like that written down. All right. And lastly, if you can, we invite you to turn your cameras on. We like to make this as close to a true shadowing in-person experience as we can. We know it's not always possible, but it is helpful if you'd like to turn on your camera just so we can engage a little bit better in this space. All right. That is it for me. And I'm going to toss it over to Dr. O. Thank you so much.
Thank you. All right. So, what's up, everyone? I appreciate you all being here. First off, thank you to Pre-Health Shadowing for, putting this together and for like, investing in students who are actually trying to do this like the right way. For those of you who don't know me, my name is Dr. Casey Ohanaja. Most people, patients call me Dr. O. I'm a sports medicine physician, medical educator and founder of Chiron Sports Performance and Consulting. So I just want to let everybody know today is just intentionally informal. This isn't like a lecture, I want to make sure this is kind of just a real conversation and like this is like the type of conversation that I wish I had access to earlier in my journey. I want to talk about what actually matters as a pre-health student, just going beyond GPA, beyond checking boxes, beyond just trying to survive the process. The first thing I want to make sure, I'm very just clear upon is like, I think most pre-health students are doing too much of the wrong stuff, because it's usually just because of what you're told by others that you should be doing. Like you're told that, you should be stacking a bunch of activities, saying yes to a lot of everything, right? Showering as many specialties as possible and then volunteering endlessly and just keep on grinding, but no one tells you how to, actually connect the dots, how to stand out, how to think like a future clinician instead of an applicant, how to do professional development in like in a structured way. And, that gap and that confusion is exactly where people, I felt like, burnout or self-doubt creeps in. And, some people call it the imposter syndrome, and that can take over. But, I'm trying to give you the insider perspective. So let me give you this like inside perspective. So, in terms of like admissions, when we're talking about admissions committees for medical schools, they're not impressed by long lists. They're impressed by clarity, growth, in your own individual process and then insight that you've gained through your process. They want to know, do you understand why you actually want to go into healthcare? Like, have you actually reflected on what you've seen? Can you communicate professionally? Like, do you understand patients as people, not just like as like a diagnosis? So I know people think about shadowing just as like hours, but it's not just about hours, it's about what you learned, how you've actually processed it, and how it's like shaped you as an individual. So if you're shadowing or kind of just like planning to, here's how to do it like in my opinion, like the future professional that you're trying to aim to be, right? So just don't just observe, ask yourself like, how does this clinician communicate? How do they make decisions under certainty or uncertainty, right? And how do they treat staff? Because that's important because the staff members, they're part of your team, right? They make things, logistically uh, go around with like the patients and how they deliver the care. The staff is part of the healthcare delivery process. So you also have to make sure you're treating the staff members, in a proper manner and in a kind manner, and also just communicating with them effectively. So how do they handle difficult conversations? That's another thing, right? So those are insights that matter more than just, memorizing procedures. And when you reflect on these experiences, I know whether it's, a personal statement, an interview, or a conversation, that's what actually separates you. So, and like another truth I want to share with you is like, students who succeed fastest don't, they don't do it alone. They actually find either mentors, communities, and frameworks and structures that help them think bigger and earlier, right? And I'm just want to make sure that you're thinking of the game of going into the medical field before you're thrown onto the field, right? So healthcare today is not what it was 20 years ago, right? You need more than just good grades. You need to make sure you're, like I said before, communicating. You have good communication skills, good leadership skills, business awareness, and then also emotional intelligence because things can go left or right. You need to be able to stay even keeled and then, go through your day and still be able to complete your job in a professional manner and with good bedside manner. So whether you're an MD, a DO, a PA, NP, a PT. If you're trying to be a future clinician, the future clinician is someone who can, think critically. They can work in teams, right? And they can advocate for patients, and then they can adapt to different situations. So that's the type of mindset I want you to leave with today. So, if you're somebody who wants more guidance, and structure and mentorship, you should obviously seek it out where you can, right? And I can provide recommendations afterwards, right, in the Q&A. And then, happy to, if anybody wants to send me a list of questions afterwards, and I can try to answer them to my best of my abilities. But I want to make sure that that's, the message that I'm delivering today. And, that's kind of my piece right now. So I want to hear from everybody else and ask me anything related to shadowing, pre-med, burnout, uncertainty, confidence, the next steps in health, like the healthcare field. And there's no such thing as a bad question, right? I want you to be inquisitive, so this is your time to ask.
Is it Tahira?
Yes.
Yeah, I see your hand up. Go ahead.
Hi. I'm a PhD student currently, and I'll be applying to medical school after my PhD. So I wanted to ask, are you a traditional student, non-traditional student, and could you share a little bit about your journey to sports medicine?
Okay. Yeah, so I'm actually a very non-traditional student. So I went to undergrad at the University of Notre Dame. So I actually started off as a like biochemistry major, which they're basically taking some honors classes in the college, and then I pivoted and became a political science, Arabic and Middle Eastern studies, and studied peace studies, studied abroad in Egypt, and but I still did pre-medical sciences, so I did it a very non-traditional route. And after I graduated college, I went to grad school, and I got my graduate degree in public health. And I got my board certification in that. And then after that, that's when I went to medical school. And then I did my residency, and then I did my fellowship after that. But I practiced as an attending after I did my residency for a year in urgent care and emergency medicine. So that's kind of my background. And and then I did a year of my fellowship with sports medicine. And even right now, like I'm doing a few different things, from a graduate school professor in the School of Health Sciences, and then working as a medical director for a few rehab facilities, basically. My experience has been very non-traditional, and I say that to let you know that your experience doesn't have to be very traditional. However, I would recommend that early on in the process, you identify like the identity of the type of professional you want to be, and the type of lifestyle like that you want to have, the type of patients you want to see. And then that way that, early on in the process, you can connect the dots A to Z of how that professional should be, practicing, right? The things you need to do day in, day out. And then you're kind of just basically slowly grooming yourself to becoming that person, right? So I'm a huge proponent of professional development, even with athletes that I work with, I like the idea that if you're trying to be a professional, right, you have to start at some point, right, and then identify the fundamentals of the endpoint of that you're trying to reach, right, and then work your way towards that, right. And it's not about just doing a bunch of random experiences and then hoping that from those random experiences something just beautiful just shapes out of it. No, it's like you got to start from point A, point B, point C, right? So, I think that's something that I feel like you can do right now in terms of your research. Like if you have a specific niche that you're interested in, then okay, then what sort of things go into that niche, right? And then maybe find a professional who's in that niche and then ask them about the components of that niche and then try to shape yourself slowly from point A to Z in that niche. So that's what I would say. You don't have to be traditional. You can be non-traditional. However, if you want a specific goal, and your medical track, I would say try to start early and connect the dots in that way. Is that helpful? All right, great. All right, so anybody else raising their hands, or we can go to the chat. Let me see. Let's see questions that have been in the chat. So I can see the first one from Venya, as what sparked your interest in the medical field? All right, so what sparked my interest in the medical field? So I, growing up, was a very avid athlete, and I was also just very into, anatomy and sciences and health. And naturally, I wanted a career that could not only help other people, but also I could be a proponent of other people's health. So that's really what sparked my interest in medicine. I actually later on in high school, got into an organization called HOSA, Health Occupational Students of America. And then after that, then that kind of just initiated my interest in medicine. And then from there, I started off doing a lot of different experiences. But that's initially what sparked my interest in health and medicine and going into the medical field. All right. And then let's see. And then the next question. Um, if you're not noticing improvement, is that a sign that maybe this is not the career from you? This is from Emily. All right. So, if you're not noticing improvement, is that a sign that this is not the career for you? So let me say this. So you're in the pre-medical stage of your track. I want to let you know that the things that they're testing you on and you're doing right now in the pre-medical stage do not define the type of clinician you're going to be later on, right? A lot of the medical sciences, yeah, I mean they're meant to be very difficult. They're meant to weed you out, but it doesn't necessarily correlate with the type of medical professions that you go, because medicine is a very broad field. It's, if you think about sports, right? Just because a person, you can think about, I use this example, like, think about an athlete, maybe they tried baseball, right? And they're not good, like, hey, like this person's 6'6", and you know what I mean? Like, they should be a really good baseball player. And then you put them on the basketball court, and then now they're dominating, right? So it's like and that's kind of how I try to look at, with the pre-medical sciences. Just because you're not doing well in one of these things, like, you could be in a completely unrelated field to that pre-medical science track that you're in, and then be doing very well. So don't take your like, how you're doing in the pre-medical sciences as an absolute indicator of how you're going to be doing in the long run as a clinician. So I know, as long as you're, staying the course and you're getting through the courses, then the next step is, okay, what type of clinician do I want to be? I think that's the main thing, right? If you are trying to, craft yourself towards a specific niche, then, I think that's the most important thing, rather than just the whole pre-medical sciences experiences. Does that make sense? And so I'm gonna look at Angelina Gonzalez. were you a straight A student? So in high school, I was a great student, right? I mean, top 10% of my class, excellent SAT scores. Coming to college and going into that major, not, I mean, obviously I passed everything, but not a straight A student. I have friends, who are doctors right now and in high level specialties from surgery to neuroradiology that were making similar grades to I am, and they're in like very high level specialties. So that kind of just shows you right there that the type of grades that you're going to be getting as a pre-medical student are not going to be as a and going to be an absolute indicator of the type of specialist or clinician you're going to be later on in your career. And let me see. And let's see what other questions we have. All right, here's a question I see from Neha. It's what do you recommend a first year college student do to get involved in the medical field? So, actually, as a first year college student, there's a lot that you can do to get involved within the medical field. You may not realize it, but you have to look at the landscape that you're in as, like, hey, these are the resources that I have to me, right? So you as a, depending on what you're interested in, you could be going into multiple different, science departments because even here at, the university that I'm teaching at, like, we have the School of Health Sciences has lots of different things related to nutrition, interdisciplinary healthcare, biomechanics, physical therapy, you name it, right? So it's like, each department has so many different like professors and different areas of expertise within the healthcare that you can find a niche right there, or even if with outside of your university look to other things. Like if you're interested in sports medicine, you can go to your like a local high school team and like, hey, they have an athletic trainer. I want to be on the sideline during the games and get some sideline experience with working with athletes. That's one thing. If I wanted to go to a nursing home facility, I could get firsthand experience working with, nurses and physicians in that practice and getting, firsthand knowledge of how to work with patients coming out of surgery. And then, hey, like, if I wanted to, get more primary care experiences, there's a lot of different, um, like free medical clinics that you can go to. I remember when I was in grad school, that's one of the things that I do to get a lot of clinical hours is that there's a free medical clinic not too far away from where I lived. And I saw homeless patients basically in their free medical clinic and doing a variety of things. And I got a lot of experience at physicians, PAs, and nurse practitioners that worked in there, as well as like medical students from the medical school. So there's lots of experiences that you can get, as a first year medical student. So you just have to look at your landscape and again identify your identity, right? Like what type of field are you trying to go into? And then you can kind of be like, okay, this is a point A of what I can do within this area. I can work on these things. Then I can find out about B, C, D, and so forth, right? So that's my advice to you on that one. All right, so let's see. Do I know anyone that went through a BSMD program and how did that work out? I personally did not. So, and this is from Alyssa Z. And I personally did not know anyone who did that. I knew of programs around me. I know when I was coming out of high school, there's a few in Texas because that's where I went to that actually had the BSMD programs, and those are actually very good programs if you actually know that's what you want to do right from the get-go. And I know some of them specifically have tracks like, hey, you can go BSMD and then you can get into some sort of primary care track. So I personally, like I said, didn't know anybody who did that. But again, if you find a program that has something that aligns with your niche, then that can definitely be a really good program to get into. But I would check with their criteria of what they need before the admission. All right, let me see. Another question. I think the next question that I'm seeing here in the chat is, um, how do you handle high pressure situations, especially when multiple patients need urgent care at the same time and it gets hectic? Asma. Very good question, Asma. So, you'll find that in every different healthcare setting, you're going to be involved in hectic situations, and each setting is not the same, right? So, a hectic situation in the emergency room can be quite different than the one that's in the OR, and can be quite different from one that's in the primary care clinic, can be different from one that's in another facility, etc. So you have to make sure that, like, hey, um, you have to remember, like, hey, this is like what these are the things that I need to do, right? And just try to check off everything that you can do one by one. And remember your fundamentals, right? If you're in the emergency room and code breaks out, right? So what are the things that you should do? One, okay, start off by assessing the patient's ABC, right? And then making sure you're communicating to the staff members around you. I always remember you have staff members around you, right? So hopefully if you're in a situation like that, and the best thing to do is communicate and delegate different things that other people can do. So you're taking responsibility of something that you can do, obviously, and then you delegate another task to something somebody else can do, and then y'all make sure you remember the fundamentals of, like, hey, this is what the patient needs, this is how we need to do it, right? Or, you're having a difficult patient, right? Situation. Okay, this patient's being difficult. Like, how can I diffuse this situation and still deliver high quality care? So making sure that always, always, always try to make sure you're staying even killed, right? Like, um, I can recall a situation, um, and I've said this before, even other talks, where I remember when I had a shadowing experience where there was like I was working in a burn unit, and we had an emergency patient come in, and it was a patient who was in like basically in their basement, and they had a meth lab in their basement, and their house blew up, and the patient basically was burned from head to toe. So we had to rush them in, and I never had, that was like my first one of my first experiences in the burn unit at shadowing, right? And hey, they're like, okay, this is what we're gonna need you to do, right? I know you're new at this. Hey, we're gonna need you to be able to, do these, these skin areas on the patient, right? And then we're gonna need to make sure that you're gonna be able to roll out and thin the skin and then put it back onto the patient, right? So The lead surgeon communicated effectively from the text, and everybody got on board, right? Like, hey, you're doing this, you're doing this, you're doing this, you're doing this. And then we handled that situation, and the patient was actually able to survive. So that's what I can say in terms of, like, if you're, in a hectic situation, you just have to make sure you recognize the resources that you have around you and then try to utilize them to the best of your abilities. Hopefully that answered your question.
Dr. O, circling back to some of the earlier questions, Isaac asked, how do you deal with imposter syndrome?
Oh, okay. How do you deal with impossible? Well, you gotta, like, recognize that you, as a person in the medical field, right? You're trying to work and better yourself every day. And just like I said before, you are aiming for an identity, right? And just like you have an athlete or a famous musician, right? They have to start at some point, right? And to get to the point that they're at, later on, right? So you have to recognize, like, hey, I know that I'm not at that point, but I'm learning every day, right? You can do what you can do to learn every day, right? So you have to recognize, like, hey, this is something that I need to work on, right? I know I'm not there, but hey, I'm gonna do my best to continue to learn step by step where I need to be, right? And that's all you can do, honestly, in any career, right? So, you just have to have confidence in your process, right? In the same setting of you developing competence in your process, right? So as you develop your competence, then your confidence comes, right? Right? And then as you get more experiences, then that increases both competence and confidence, right? So that's how you got to look at it, right? So, a physician who's, 1 to 2 years post residency, or 5 years post residency, versus a physician who's 20 years into their career. I mean, they're both physicians. It's just that, one of them's a little bit further down the line, right? But they're still practicing, right? And they're still developing. Each one of them is learning the process. And even some of my attendings that I've worked with in the past, like, they're still learning, right? And but they've kind of had their own process in that they've kind of harnessed from the beginning, right? And then they're just at the end, they're more seasoned and they're little tweaking things here and there. But again, it's a process, and you got to make sure everybody has to go through that. So I just hope that, like, that makes that question a little bit more clear.
And Babatha, I hope I'm pronouncing that right, asks, what does teamwork mean to you?
Teamwork means to me that everybody in that process is working in unison towards a common goal. And everybody in that process knows and wholeheartedly believes and takes responsibility of their individual role in that process. That's what teamwork means to me. And everybody being committed and dedicated to reaching that goal in that process. So if you're working together as a team, right? Whether you could be a support person, a leader, right? But everybody in that process knows their role, they're committed to it, and they're working in unison towards a common goal. So that's what teamwork means to me.
Brandon asks, in your experience, what has been the most challenging aspect about being a physician?
One of the most challenging aspects about being a physician is the, I think for most people can be even be like the delayed process, because sometimes uh you're going through the process, but you don't know how the next step in the process is going to be, right? unless you've had somebody there who's been with it. So I think that's kind of been one of the most like difficult aspects of it. However, I would say that learning in that process has been a fruitful process and an enjoyable process because at the same time, as you go through the process and you're going through obstacles and you're overcoming those obstacles, you're growing, right? So I think that's one of the, most difficult things about the physician process. And then also there's a lot in the physician process, like or becoming a physician. Like you go through the medical training, but then once you become a physician, there's a lot of nuances to I'd say the physician game that you didn't know, you didn't learn in medical school, right? You didn't learn in residency. Like, hey, like, and these are things that you don't necessarily have to worry about right now, right? Because I want everybody to focus on the fundamentals, but you're navigating, politics, you're navigating contracts, you're navigating practice settings. So in each setting, like I said, it could be very different from the next. So those are things that obviously are all part of the game. You just have to adapt to. But again, those things are difficult. But again, if you've made it through the process and you're battle tested, then you should be able to overcome those things, right? Hopefully, I answer your question.
Um, Trisha asks, how do you practice mindfulness and self-care as a physician?
Mindfulness and self-care as a physician. So I feel like my family, it keeps me very rooted in who I am, and I like to take some time to unwind with them. I have a newborn like daughter, and then I have my wife and I. We always make sure we spend time together and take time to reflect upon, the blessings that we have, and then take time to reflect upon things that we've learned in the process, and also just stay grounded in who we are. And whether it's just be taking time just to I remember last year just us taking time just to meditate and reflect on things, taking time to relax, travel, go out in nature, just to kind of stay grounded in the world and, reflect on, hey, like, yeah, we're in the hustle bustle of things, but we have to stay true to who we are and also remember, how far we've come and what things we have that we should be grateful for. So I think those are things that I do. I mean, as far as self-care, I'm very into like, fitness and working out. So I felt like that always rejuvenates me and keeps me grounded as well. And especially when, I feel like, a week has been long or I've worked a lot, I think kind of helps me reset my mind and my body and just keeps me more focused. So I think those are some of the things that I like to do as far as maintaining mindfulness and self-care as well.
Congratulations on your daughter, and we thank you even more for being here because your time
Yeah.
stretched even thinner.
Yeah. Yeah. So it's been it's definitely been a juggling act, but she's a blessing to both of us, and we're really happy to have her. And she's definitely given us a different perspective on life for sure.
Beautiful.
Mhm.
We have a few folks asking about the MCAT. Someone asked advice for anyone who wants to take it in 5 months, and somebody else asked if you know any resources that can be useful for studying for the MCAT.
Okay, so as far as developing a 5-month plan for that person individually, again, I would have to know like where you are in your process, and I'd say a good gauge would be to if you've taken any type of assessment to see where you're at, because then that kind of gives you a solidified like benchmark of like, okay, where are you in this process, if you were to take the exam today, right? And then, for some people, 5 months if they only need to increase their score by a few points is enough time. But so for some people, if they're, 5 months away from the test, but they're, you know, a significant range to their goal score, then you're gonna, need to reflect like, okay, do I need a little bit more time? Do I need to maybe take a little bit more time to study for this? There's and lots of different test prep courses out there. I think even back when I took it, it was like Kaplan that I took, and like so, there's lots of good, MCAT study resources out there. Kaplan's obviously been one of the long-standing good ones, so that's one I took and I recommend. So, but again, it's all about knowing where you are in the process, and then I would say a good thing you could do is going to the MCAT National Resources and looking at the objectives that they have for the test, and then looking at if you can see if like okay these are the percentage of type of questions that they're testing on, and then trying to hone your study towards that, and then also identifying like the areas that you feel weak on because that's going to be something that's going to make or break your score. So if you're studying for the MCAT and you see yourself struggling on one particular subject matter and that's really what's hampering down your score, then I would say try to, focus on your weakness and then make that a strength as much as you can.
Dev says, congrats on completing your medical education and sports medicine fellowship recently. They wanted to ask what are some of the valuable and quality extracurricular activities that you did during your undergraduate years to prepare for medical school?
Um, so during my undergraduate year, I did a good amount. So I did some volunteering in a hospital. I did some, I believe I did even did some volunteering at a homeless shelter. I traveled and studied abroad in Egypt, which was something I felt like set me apart from a lot of different applicants because studying in a different country and having to learn a different language, right, was something that, is kind of shows how a person can adapt to different situations. So if you have any type of, unique travel experiences or travel or study abroad experiences during undergrad, I'd definitely make sure you highlight those in your applications, even if they're not medical related. Um, and I think those are, and then also I did research as well in the biochemistry department and got published for a research project that I was a part of. And I also worked in the biochemistry lab um, in undergrad as well. So I did a variety of things, but and then also there was like a public speaking class or that I was the assistant of, so I got involved in that. So there's a lot of different extracurricular activities and clubs that I was, president or vice president of, and I think those things in general kind of helped shape my application and kind of, help me in the med school application process.
And Kato asks, did you feel your MPH prepared you for medical school slash is applicable to your current work? And did you want to use that master's if you hadn't gone MD?
Oh yeah, the MPH actually I felt like is very applicable to a lot of different things that I'm doing. Number one for MPH, so my focus was healthcare, health management and healthcare management and policy, as well as like healthcare program planning. So within that master's, I learned so many different skills that I've been able to apply not only through med school, but also residency and even right now in my practice. So for med school, in public health, like for the USMLE, there's a lot of different, biostats and public health related information that's on the USMLE that I felt like that helped me in that process. And then when it came to doing certain initiatives where I was the president of a club and we wanted to organize a community health initiative, what I had learned in my graduate degree kind of helped me in the process of shaping those type of community initiatives. And even right now, as a medical director, we have, you know, monthly like quality rounds where we look at and analyze, okay, these are the statistics of how we can, how we're doing in terms of like hospitalization rates and, infection rates and things we can do from a public health standpoint within our facility to limit falls, fall prevention, etc. So and then or rehab or protocols, those sort of things. So it's like those things that I learned in my graduate school have been applicable to so many different things, even when I was in also even in like sports medicine fellowship. Some of the things that we did in terms of like being able to organize like athletes into doing mass physicals, right? Like those sort of things. Like you don't really think about it, but in like a graduate school program like involved with public health, you learn a lot of those different niche things. And the course that I actually teach at Oakland University in the grad school deals with evidence-based decision making in healthcare in multiple settings. So I draw upon my experience in from sports medicine, from family medicine, from public health, and then that's what I've been teaching my students. So, and a lot of that material also came from my time in graduate school with the focus on healthcare program planning. So, if you have a graduate degree or you have some other graduate niche interest, you can also combine that with your medical interest and do a lot of different things.
Our next question is from Asma, who asked, how do you stay motivated during long study hours and clinical rotations?
Staying motivated during that process, you have to recognize and remember what your goal is, right? So even if you're at one point and it seems like, you're just going through such a daunting day and everything's against you, you always got to remember, hey, where's the end point? And as long as you remember, like, hey, this is like the point of what I'm trying to do or the goal that I'm trying to reach, then you understand like, hey, this is a process. And, like for you to reach point Z and you're starting at point A, there's going to be a lot of repetition of things that you need to do to get to that point. And people underestimate that. And, you as a pre-med, I think, a lot of people are, recognizing like, hey, yeah, pre-medical sciences, they're hard, right? But again, like this is just point A. So then once you continue to build upon the different steps in the process, you'll see like, okay, I've made it past point B, point C, point D, right? And I know that I'm moving along and I'm getting closer to point Z. So, and that's what I want, right? And as long as you know from the beginning, like I said, what type of identity you want and what's your end goal, then that keeps you grounded and that keeps you motivated, right? And I think that's how I approach it every day because not every day is going to be easy. Not every day is easy. You just have to keep in mind what type of person you're trying to be and what type of goal you're trying to reach.
Thank you for that answer. Moving on to Maria, they asked, did you ever consider other healthcare professions like PA, NP? If so, why did you choose the MD route?
Yeah, I mean, in terms of, considering PA or NP, I mean, I had done my research on them, and there's obviously nothing wrong or against those. Like if you want to be a PA, there's a lot that you can do as a PA. If you want to be a PT, there's a lot you can do as a PT. If you want to be an NP, there's a lot that you can do as an NP. So, like, I mean, each one of those has their own, benefits. But for me, I wanted to become a physician, and I knew that with the things that I wanted to gain out of my career, I could gain more from the things I wanted to do being a physician, right? And I knew that I would be able to have access to do certain things more so as a physician. So and that's kind of how I approached it. Well, like me wanting to be a sports medicine physician. I knew that with that, as a sports medicine physician, I could, if I wanted to work with athletes, youth athletes, I could do that, right? And then I could also, at the same time, if I wanted to do primary care with them, I could also do that. If I wanted to do consulting from the sports medicine, the sports performance aspect of that, you can do that. Here, I mean, even at Oakland University, like, and there's, when I first started working with them, they're like, okay, well, as a physician, we have a lot of research projects that are going on in our, PT area. So like if there would ever be a time that they wanted me to consult as a physician for those research projects that they're doing, because I have the clinical experience, that adds to their research. So as a physician, there's so many different things that you can do from whether it be clinical practice to consulting to research, right? And then like on terms of like how you market yourself in your niche that you can do in so many different settings, and I felt like that's what I wanted. But again, you can do a lot of different things in other settings and as a PA, as a PT, or as an NP. But for me personally, that's what I felt like was the best route for me.
Babatha asks, is there anyone in the medical field with whom you can't work with?
Uh, with whom I can't work with? Is there like in terms of like age group or
Um, I'm thinking we have a couple other questions about maybe the way you deal with difficult counterparts, so maybe we can answer it both ways. Like any
okay.
people that you have issues dealing with in the fields, colleagues, or maybe difficult patients.
I mean, I've being both in like the family medicine, primary care, and field. I mean, work with all age groups, all settings. So I mean, there's I've been exposed to all of that. So as far as I can't work with, not necessarily, nobody, but as far as like preferences, I mean, obviously I have a preference towards, working with, me being in my subspecialty athletes, but also adults who want to regain function. But I don't think there's anybody that I can't work with in terms of age groups or background.
G asks if you have any advice for building meaningful connections with healthcare professionals when shadowing opportunities are limited or unavailable. Specifically, they are a pre-dental student.
Uh, so the question is trying to gain meaningful experiences with healthcare professionals when they're limited
Or unavailable.
or
Either.
unavailable. Okay. I would say maybe even looking at creating your own experiences in certain settings, or at least being a little bit more assertive in reaching out to those healthcare professionals, because you don't know, like if you could reach out to like a few healthcare or dentists around you, and there may be one that might be like, hey, yeah, well, I don't have a lot of time, but on Wednesday mornings I have a good patient load that I think would be good for you to see. So even if it's one day that you're coming in there in the morning, right? And you're seeing a few patients, that's something, right? And then people don't realize also with like, hey, I don't have, a professor to do research with or do anything with like, there's a lot of things that you can create on your own. I remember even when I was in residency, so, me having an interest in doing sports medicine, like one of the things is like, oh, they want you to have medical experience, right? Or, either shadowing or doing something. So I remember there was one earlier on in the semester, I was like, hey, I just want to find something just to get me my foot off the floor. And then I was like, okay, well, hey, why don't there's this like jujitsu tournament here. I could provide medical assistance in this tournament, right? And just basic because they had people who volunteered to do that. I'm like, well, and then they're like, yeah, that's actually a smart thing to do. So, I mean, if shadowed like that one dentist in this that one morning and those few patients, and you saw an interesting case, hey, let me write a case report on that interesting case. And then before you know it, you got some published research right there, right? And all it just started with you just being assertive and reaching out to people, and then you found one person, and then you found one patient, and then there's your research, right? It's like a domino effect, right? So, you know, utilize your resources around you and try to, do as much as you can to network and do outreach to people around you who are in fields that, you have interest in. I know it can be hard. It can kind of be a tough if like, you're, just saying like, oh, no, we don't accept students or, we don't have time. But lo and behold, like, there may be one, just one. That's all you need is one dentist. You don't need to have multiple dentists. Like you could gain a lot of experience just from being with that one dentist. And even if it's one day, and then they're teaching you so many different things, and that's all you need. And from that experience, hey, you're seeing like, this case this week and another case this week, and then you're writing a case report, one case report each week or something like that, right? And before you know it, you got multiple publishings, like, and that's just from one dentist. That's all you need. You don't need like 20 dentists, right? You just need one, right? So, I mean, that's all I'm trying to say. Like, just try to look at your resources and then do as much as you can to do some outreach in that point.
We have a few follow-up questions about shadowing. Someone's asking how they can get involved in shadowing and how many hours is considered efficient.
I would say don't look at the quantity of hours, look at the quality of hours. And in terms of getting in touch with somebody for shouting, just yeah, basically what I just said before, doing outreach, whether it be on your in university, local healthcare centers, and seeing if there's any available providers to allow you to do shadowing, organizations that help you get set up with shadowing, such as yours. So it's like um, try to do your due diligence and doing your research on resources around you to put you in place with shadowing hours.
Someone else in the same vein of shadowing is asking, are there any things that you would say or any tips on what to do and what not to do when you're shadowing in a hospital?
What to do when you're shadowing? Be very observant, be very helpful, ask what you can do to help, ask questions, what not to do, be distant, be uh, not attached to the what's going on in the patient care, not taking note of things that could be very notable experiences to speak upon later on in your medical journey, whether it be in an interview or to another person. If you so taking note of those experiences and being like, hey, this is a win. This is something that I learned, right? Because you're gonna see so many different things, and you never know that that one thing could be a pivotal point to talk about, or a pivotal point in how you see medicine and down the line. So those are just like a few things I felt like you should definitely do when you're shadowing, right? And then things that you shouldn't be doing when you're shadowing, right? And then obviously you presenting yourself in a professional manner, and then also being very approachable. You don't have to be the most talkative person, but at the same time, just being approachable and then having those good interpersonal skills and good bedside manners. Those things help along in the way when you're shadowing.
Samia asks, in your opinion, how hard is it for an international student, not Canadian, who is doing pre-med in Canada and would like to go to a US medical school?
Doing pre-med in Canada, I'd like to go to a U.S. medical school.
And they're not Canadian.
Okay. I mean, it's possible. Like, I mean, look, in my medical training, I've seen people they did medical school in another country and they come back to the US and do residency, and then they become a internist, a OB-GYN doctor, a surgeon, right? You name it. So where you're coming from in terms of like your country of origin, like as long as you have a good strong background and resume, I think that there are schools out there that are going to give you a chance. I'd obviously say to look at the schools out there and see and maybe target ones that maybe accept international students, because I think those type of programs might be a little bit more open to accepting international students. But they're out there. You just have to do your due diligence, and then also make sure that you maybe if you have somebody who's connected with that program that you can reach out to, then you can maybe introduce yourself to them, and then like maybe find a little bit more information. That way they kind of get to know you, and then you can go from there. But yeah, it's certainly possible if you're in Canada and you want to apply to a U.S. medical school to get into a U.S. medical school. But again, you'd have to do your research on the schools that take international graduates, and then try to make sure that you put those ones on the top of the list. But not to say that the other ones are off the list as well.
Um, Pedro asks, in your opinion, what do you think makes one stand out to admissions committees?
Like I said before, a person that clearly knows why they're going into healthcare. They've demonstrated it in their experience. They've highlighted it in their resume or their personal statement that they've grown from experience. And then they've showed either some sort of competence or growth in their process from point A to wherever point they are right now, right? I think that's what makes a person stand out into the admissions committee more than anything else. Of somebody who's like, okay, this person clearly is confident in knowing why they went into medicine, and they've demonstrated in their experience. They're very unique. They easy to talk with, right? I think those things in terms of your personality, who you are, and where you've come from and what you've built, stand out more than anything than just your grades alone, right? The grades definitely help, right? Or the scores, but the I think those other things I mentioned are more differentiating factors when it comes down to the admissions committees.
Another question that we have, somebody asks if you work in a clinic or a hospital, and what is your daily routine like if you have worked in both or either?
Okay, so if they're asking about my current setting right now,
Yeah, current or past in clinic
okay,
or hospital.
okay. So past, I've worked in a hospital, worked in lots of different clinics, ER, urgent care. inpatient, obviously sports medicine, training room, sidelines. So I've worked in a variety of settings. Even right now, it's more of a combined subacute facility, rehab facility for patients coming out of procedures and surgeries, and then having like the PT rehab center in there. So that's the setting that I work in currently. But like I said, I've worked in a variety of settings, and in medicine, once you get into medicine and become a physician, you might, if you're working with a group or a hospital, be working in a variety of different settings.
Right. All right. Next question is from Yuet, who says, for medical school applications, if an applicant is not accepted in the first cycle, how many additional cycles would you generally recommend attempting before reconsidering their path? At what point, if any, would you suggest exploring an alternative route, such as becoming a physician's assistant or other type of provider?
Um, I think that's dependent upon the person, right? And then what they actually want. I mean, I've known people who are physicians now, they applied to medical school maybe 4 different times before they got in, and now they're a physician. So, some people might be like, well, why didn't they just go to, another route of, PA school or, nursing school? Well, they wanted to become a physician. So, it's however much you want it, right? Because if you want to, become a physician and you have the time, right? You don't have any other obligations, and that's what you want to do, right? And there's nothing else, then yeah, you try to pursue it as much as you can, and then look at all the other options around you to get to that point. So, I know it's not like the most clear of questions, but again, I felt like that question is based upon the individual and those circumstances. So it's hard to uh, paint it as one single brush for everybody. Mhm.
I see Abisoye says one of the lessons I've learned slash experienced over the past weeks from PHS is the application of personalized medicine, like the Human Genome Project or gene data in clinical practice. Are there any applications of personalized medicine in your everyday clinical practice of sports medicine?
Personalized medicine,
Yeah, or any examples that you can give where you utilize the Genome Project or gene data specifically to deal with patients.
gene data. In sports medicine, as far as gene data, now we mean there's, with functional medicine, we have a new, like more up and coming, um, like laboratory evaluation where now we are able to identify gene biomarkers that can let you know, like, okay, you're at risk for these certain inflammatory conditions, or your genes respond well to this type of diet and these type of things in order to function well. So there's that. And then within sports medicine, I mean, there's also the orthobiologics where we're using things such as stem cells, bone marrow aspirate, extracted from, your own body to help and with promotion of healing of certain tissues from injuries. And then, as far as any other personalized data we have in sports performance where we're, you know, analyzing the human movement on an individual basis and then looking to see, okay, based upon these metrics, you're at risk for these type of injuries, and this type of issue down the line. I think those are the things that, at least in sports medicine, at least from a personalized data standpoint and research standpoint, that are out there right now. But as far as like anything related to like the human genome project, I'm not really sure about that right now. Mhm.
Dr. O, I know you mentioned doing some research in your undergraduate career. We have a high school student who is asking if you did any research in high school and if you could give any advice for finding or securing healthcare related research opportunities that would strengthen college applications.
So I actually did not do research in high school. I did a lot of shadowing and volunteer experience, but I did not do any like specific like healthcare re related research in high school. But again, if you have the opportunity to do it, I would say go ahead and do it. I mean, there's even when I went to what was it, AMSSM one year. Again, I think I remember seeing um, students as early on in college that were presenting their research posters there. They even maybe even a high school student who came with uh, uh like an attending, so that they are working sideline games with. So it's possible. I mean, if you know what you want to do and that's something that's out there, then yeah, go ahead and you can do a research project. As far as getting connected with research projects that would be good to boost your college application. Again, like I said before, look at the resources around you, right? You know, if you have a good idea and you know the niche that you're trying to focus on, reach out to professionals around you, reach out to different healthcare centers, reach out to the universities, right? And then, maybe see if you want to do something that's patient-based, you can do case reports, right? Case studies, poster presentations, look at different organizations out there who have national conferences because they either may have openings for poster presentations or case reports to be presented at their national conference. And I know AMSSM, if everybody who doesn't know, that's American Medical Society of Sports Medicine, holds a national conference every year in a different state. So I mean, that's just one example, right? The AAFP, right? The American Academy of Family Physicians. So, or the AAP, right? The American Academy of Pediatrics. There's so many different organizations out there and academies and colleges for different healthcare fields. You can also look at those as well as resources for different research projects.
You also talked a little bit about kind of challenges within the fields. And Anna is asking, what is the most challenging aspect you can think of when going to school? And what is one thing you wish you would have known earlier about going to school?
Well, I'll start off with one thing I wish I would have known earlier about going to school. Is about nobody's gonna come in, structure everything for you at each stage, right? You're gonna have to be your own advocate. You're gonna have to be your own um like in terms of architect of how you shape it, right? So if you know from the beginning what type of identity you want at the end, then you start from that point, and then you know how to end, then you have an advantage. So that's I would say as far as like one thing that I didn't know, and in terms of another thing that the second question was
Kind of, I think, the most challenging aspect
the
about.
most. I would just say, I mean, actually, those two going hand in hand, like having to shape it for yourself, and then also like, um, not anybody having to do that for you. So that's also the most challenging aspect, and one thing that I wish I had known from the beginning as well.
Anas says, would pursuing a nursing degree before applying to medical school be helpful experience-wise?
Oh yeah, absolutely. I had a friend. Actually, I think I knew a few people. I knew I had one friend. He was actually a nurse before coming to medical school, and then that definitely helped him out, and he's doing really well as an internist. So yeah, I can say absolutely like if you're a nurse before going to into medical school, that definitely helps. It's nursing in itself has a lots of different challenges. So if you're battle tested in that area once you come into medical school, although a little bit slightly different, then you'll still be in a good position for leveraging what you're doing.
Combining a few questions here about working with people. We have someone asking if you've ever worked with a difficult staff member who isn't communicating effectively or understanding what you're trying to say and how you handle it. In the same vein, are there any specific personality types that you find difficult to work with, like people who are self-centered, or maybe really want to take the leadership role?
Uh, I would just say if you're handling a difficult staff member, just try to stay calm, right? Don't try to escalate things. If you have other leadership support around you, you can even communicate with them, but not in a confrontational way, right? And then, or just kind of addressing with that other staff member, like, hey, these are the things that I feel like you should be communicating a little bit better on, and then try to like explain it in the best way you can, right? Without being confrontational. And then if they're still not, getting like, you know, effective communication out of that, then you can go another route where you talk with another maybe support staff member or leadership person, and then I would say get them involved, but at least ask them like, "Hey, this is what's going on. How should I approach this?" Right? Because you always want to make sure that like you're not trying to put down other team members, and they could be, being difficult for some particular reason, right? You can even ask them like, "Hey, is there something that's going on that like it could be they could be feeling sad about something, or I don't know, like you know what I mean? Like so, that's how I would approach it."
Given your background in sports medicine, family medicine, and public health, how do you recommend or incorporate exercise into patient care?
So yeah, so exercise into patient care is a very integral part of sports medicine, especially primary care sports medicine. So for a lot of our patients, we were in charge of putting together home exercise programs to recover from different injuries, or if patients were going and trying to prepare for like a marathon, and they had an ankle injury, like okay, how do we, or had a hip injury, how do we progress them along and keep them healthy. So those are certain things that in my time with working in sports medicine that I've been able to do, that I'm a huge advocate for. Sometimes it can even be giving advice about nutrition, right, and exercise, and maybe structuring a diet plan for a person who's trying to lose weight, and but also wants to have an exercise plan in hand. So those are certain things that I do as well, from a treatment standpoint, to incorporate exercise and nutrition into my patient care plans. Mhm.
Someone asks, what advice would you give an older adult who's 50 plus going into medical school?
50 plus going into medical school. I mean, if they if that's what they're passionate about and they want to go into medical school, I mean, I'd say by all means they can do it. I recall that I remember when I was in residency, there was two residents in the internal medicine department. One of them was this guy, and then his mother was also in the residency program with him. So it was just a very interesting dynamic. But again, she was just showing like, hey, I wanted to go into medicine. I went into it with my, like at the same time as my son. But hey, like, I mean, even though I'm this age, I felt like I'm able to achieve it. And she got into residency. She's practicing attending. So I mean, if that's what they want and they want a career change and they're passionate about it, by all means do it. Just like I say before, like at that stage you might not have the time to do take as many years to figure things out, but if you can kind of like shape out a path of what you're trying to achieve and the time you're trying to achieve it, then I think that also help serve them well at that stage.
It's interesting that you bring up that story. The student said that's pretty much what they're doing. Their son is going into it with them. That's
Oh, nice.
cool. Danielle says, what is some advice for supporting yourself financially through school? Are there any financial aid programs that you know that are good, or is it feasible to work part-time?
Part-time was an undergrad or medical school. What stage are you
I think they're talking about professional school.
in medical school?
Yeah.
Okay. As far as in medical school, I know at least in my medical school, students could make money on the side with like, doing like teaching or tutoring. I know that there's more and more companies out there that are hiring people as either doing consultants or even test prep for like MCAT, right? So you got to look at like things like that and and also just make sure that you're able to fit it in with your study time. But I think right now, even compared to when I was in school, like medical school, there's a lot more opportunities for medical students to get part-time jobs or side jobs while they're in medical school, and gain some extra income on the side. So I would highly recommend that if you have that opportunity and ability, and explore the resources out there and make sure that it's a good fit for you.
Next question is, do you have any tips for going into sonography?
Like ultrasound.
Yeah.
Well, so s- sonography for OB-GYN, sonography for emergency rooms, sonography for sports medicine.
Um, Feel free to add some context in the chat, but I think maybe sonography and sports medicine might be most applicable to you if you want to answer it that way.
Okay. Yeah, for sonography and sports medicine, there's a lots of different resources out there. So MSK ultrasound is a more relatively new imaging modality. I think within the last maybe 15 to 20 years in sports medicine have they really only started to like use it more frequently. And it's now it's like a mainstay of sports medicine practice and evaluation and therapeutic procedures. So I would say there's a lot of books out there if you want to get involved with some of these other organizations like AIM-SSM. They also have modules online that you can go and watch videos on ultrasound evaluations of different body parts. As far as getting hands-on experience, AMSSM and also even some universities, if they have cadaver labs, will have ultrasound or cadaver lab based ultrasound lab days where you can actually use an ultrasound probe and use it on a cadaver and see different body parts. Go to some of these conferences, AMSSM. Also, I'll have some cadaver lab sessions if you wanted to get some practice there. Purchasing a handheld or ultrasound if you have the money. I know it's pricey, but once you get to like residency or indoor fellowship, if those programs usually give you like some sort of stipend that educational stipend that you can use to purchase equipment and devices like that. So that's another option. And then you can practice at home on yourself as well. So. I mean, that's what I recommend in terms of like trying to get yourself experience with MSK ultrasound.
And what's some advice you would tell a pre-med high school student?
Pre-med high school student, same advice that I gave earlier. Like, know your identity. You're only at point A, right? So find what that is and then begin incrementally, right? You're not trying to perform, perform a surgery right now because you're still at point A. Learn the steps for point A and B rather than trying to like, okay, well, I want to, you know, learn this, like complex surgery. and how to do it, and I'm gonna practice this on some random like cadaver, right? Like no, like you just need to start at point A, right? Like, that's where you're at, right? And then once you master the fundamentals of, the basics of what you're trying to aim to get to, then you can build upon and layer those other things.
Isaac says, what part of Egypt did you visit and what was the most memorable thing you took away?
So I was in Cairo, and I mean, Egypt is a beautiful country, so much history. Did lots of, enjoyable things over there. Saw the pyramids. I think one of the um, best things that I like enjoyed about Egypt was the hospitality of the people over there, and how they treated each other and other people. I think that's was something that I really took away from their culture, and also just being able to immerse myself in a different culture and then adapt to that culture and learn from other people, um, and just see a different environment for how it is. So I think that was something that I really took away from that experience. And even right now, like, when I, come into residency, there's a huge, like either North African and Middle Eastern population in the Metro Detroit area. So that was also helpful, being able to like have that experience and then being around patients from that similar community, right? But again, I think the main thing that I took away from that is being able to adapt and be welcome into new experiences and new cultures and new people, and being in a new environment and having to be comfortable in a new environment like that. So,
Dr. O, I know we're coming up on time here, but we do have three more questions in the chat if you have time to answer them.
okay, yeah, really
Okay.
quick.
Someone's asking if you have any experience using Anki.
Anki,
Yeah.
yeah. So, I used that a little bit back in medical school. So yeah, it was a good resource for like note cards and running through concepts. Yeah.
Um, I th their specific question was, how do you suggest using it?
Well, how I learn can be is a little bit different than maybe how some other people learn. So it was I could say, for example, when I did microbiology, right? So I learned microbiology or pharmacology best by connecting maybe drug pathways and pharmaceutical pathways to pictures, right? And yeah, there's, obviously, I don't know if anybody knows of the Sketchy Micro, Sketchy Farm series, but I incorporated things like that, concepts, and connecting them to pictures. So anything that's high yield, like that, you can put them on note cards, for like subjects like microbiology and pharmacology, and going through them with friends. I think that if you can kind of gamify it, that also works. I remember when I was in medical school, I had a group of friends like for like classes like biochemistry. We would take objectives, create them into questions, right? And then we would kind of like do like popcorn style, like and gamify it and see like who could answer it first, right? So once you kind of do it like that, it's a little bit more, it's challenging, but again, it sticks with you a little bit better. And then I think it makes better use of that resource.
Next one, Asma says, I have my associate in general studies. As someone who is going into sonography, I tend to feel like I'm behind and on a time crunch. What are some benefits of having the associates in general studies?
Associates in general studies.
Mhm.
Can she elaborate a little bit more about her associate in general studies and what it entailed?
Yeah. Asma, if you want to elaborate on that in the chat, and if we get that elaboration, we'll answer it out loud. Otherwise, we can follow up. A different question is, Do medical schools care about which four-year university you attended, like if you attended a UC or private schools? And also, do they care about your major?
Medical schools can admit people who majored in anything like a language, Spanish. I knew people that I went to college with that they majored in just a language and they got into medical school. So medical schools don't necessarily care about your major. And then as far as anything else, like in relation to that, it's more about the person and who they are and then like their personality and what they have on their resume in terms of their experiences. So in your colleges, like that also doesn't really matter as much. But I would say that maybe if you went to a more challenging school, and your GPA might not be as high than a person who went to another school, then they could take that into consideration. But as far as majors, then no, as long as you have the basic credentials and the basic sciences and the tests that you've passed, and everything else is just another differentiating factor that they look at.
Um, I don't see any elaboration from Asma, but I think a popular question that we might get from students who are maybe career changers, if you have any advice for folks who have to take their prereqs elsewhere, and how they would kind of word that to admissions committees or talk through that.
No, you just, hey, I am taking my prereqs. Mean I took my prereqs and then, like I said, I was a poli sci major, right, as well. So again, you just have to emphasize like your strengths of like who you are as a applicant and your experiences, and then the prereqs as far as like if you're taking them elsewhere, you can explain, well, okay, why did you take them elsewhere? Well, okay, well, this is I took them elsewhere because they were closer to home, right? And I wanted to make sure that I really understood the material very well, right? Or for another reason, right? And then as long as you have just a solidified reason of why you took them and you did well in it, I mean, they're really not gonna like it's fine. So I think the main thing is trying to make sure you have a solid background in your extracurriculars, your experiences, and explaining like your personal statement of why you're going into medicine and what you've learned.
Thank you so much for your answer. We appreciate that. We have a few wrap-up slides, and then we can wrap up our session. All right, here we are. Like Dr. O said, reflection we find is really important for health professionals. So please take a moment to think about your favorite moment or example from today's sessions, any questions that you have, and feel free to send us an email at info@prehealthshadowing.com if anything comes up, and we'll try to coordinate with Dr. O to get any follow-up questions answered. Also, if you could, please give us some love on LinkedIn. We find that it's a really great method to combine our professional networks for students. For those of you who don't know or might not have a LinkedIn yet, it is a professional social media platform where you can expand your professional network, and Pre-Health Shadowing does have a page over there. Feel free to send us a message, especially if you want to get involved. Another plug for our volunteer team. I am a volunteer, so I'm happy to stick around after session and talk to any folks who are interested in that path. Again, we also have some leadership roles that are open if you'd like to. Also, if you can donate, that would be greatly appreciated. $1, 50 cents, $5, your time, or sending this to your network. All of those are applicable and encouraged. Lastly, make sure to please take our post-session assessment. It is active and live on the website. It is a 10-question multiple choice quiz based on the presentation that you just heard. You have two chances to pass with a 70% or higher. If you have any issues accessing that quiz, please let us know, send us an email, or stick around after session and we can talk you through how to get to it. All right. If you missed any part of this session, I know a few folks got kicked out in the Zoom sphere. That's something that happens sometimes. You can see the session up on YouTube. You can see Dr. O on the big screen near you. Watch it at your leisure. Um, and it's a really great place to see all of our past sessions as well. So you can log on to those after the fact and go over the session and then send us an email if you have any follow-up questions. All right, be sure to catch our sessions every week. We have a great opportunity with MAPT for a workshop tomorrow. We talked a lot about kind of NCAP prep and planning your application. If you want more of an individualized approach, we will be meeting with MAPT tomorrow and they can help you get started on planning your specific journey within healthcare. So feel free to jump onto that session. Lastly, Dr. O, we can't thank you enough for this experience, and we do appreciate you answering all the questions and making it specific to some of our students. This is a great experience for them, and we get so much positive feedback on students being able to ask about their more niche or specific interests or personal experiences. So thank you for sharing, and congratulations to you on all that you've accomplished and your newborn baby girl.
Yeah, thank you. Appreciate it. And thank you again for inviting me.
Yeah.